Now, if I hurt my wrist, will I need surgery?
Um, Wrist fractures, again, it depends a little bit on what type of fracture it is and what the pattern is and whether or not it affects the position or alignment of the joint. So if the joint is lined up straight like it normally is, then you would not require surgery. It can be treated in a brace.
When would I need a cast?
You need a cast. Most of the time I treat mostly kids in casts. Adults I'll treat in some sort of removable brace. If it's a surgical problem, then you'll need a short period of time in a brace. If it's a non-surgical fracture, then a lot of times it can be treated in a brace or a cast for about 4 weeks. But most fractures are going to be treated in some sort of brace or cast for a certain period of time.
Can I use my hand while my fracture heals?
Usually, once the fracture is casted or braced, then the hand can be used normally within the splint. So writing, doing things where you fine manipulation with the fingers can usually be done in the brace.
How long would I be off work typically?
It depends on what you have to do. So if you don't have to lift with that hand, you can work right away. So if it's just a matter of typing or writing or doing desk type work, then you can certainly work right away. If it's something that's going to require a lot of lifting, then it's probably going to be difficult to do that for the first 4 weeks or so.
Will I have any long-term effects from this fracture?
The problem with wrist fractures is that they have to be splinted or braced for a period of time. After that, depending on the age of the patient and the type of fracture, there can be some limited range of motion for a while. So the wrist can get stiff, which may require some physical therapy for a period of time. If the fracture heals and therapy goes well, then most of the time there won't be any significant long-term effects, but there can be some loss of motion long-term.